With COVID vaccines comes the promise of light at the end of the tunnel. That said, it's always safer to manage expectations as the UK returns to its strictest lockdown since the spring. As Germany and France extend confinement measures, the whole world is watching new strains of COVID-19 out of England and South Africa. Will vaccines be enough? Do new variants mean that humanity has to learn to live with coronaviruses? What future for infectious diseases in a globalized world? On that score, the pandemic may have relegated to the back burner concern over climate change and our disruption of natural habitats. But if it is indeed animals who transmit disease, it is now time to connect the dots perhaps and rethink spending priorities. What if it's more scientists and forest rangers we need, not soldiers and border guards? Today in the France 24 debate, we're asking, will it be over soon? Or is this the new normal and we have to prepare for it? Joining us in the France 24 debate from Edinburgh, Dr. Alison Pollock, Professor of Public Health at Newcastle University. Welcome back to the show.
Thank you. Good afternoon.
From Bordeaux, Dr. François Dabies, Professor of Epidemiology at the University of Bordeaux. Welcome.
Thank you. Good evening.
From the French capital, Tamara Gilles-Vernick, researcher in medical anthropology and ethnohistory. Thank you for joining us.
Thank you for having me. Nice to be here.
And from Berlin, France 24 correspondent Nick Spicer. Happy New Year. The France 24 debate on Facebook and Twitter.
Thank you, too. Nice to be with you all.
And on Twitter and Facebook, hashtag F24debate. Nick, after the UK, it's Germany's turn, I see, with an extension of lockdown and restrictions on non-essential travel to a 15-kilometer radius.
Yeah, Angela Merkel just spoke after a meeting with regional premiers that went on much, much longer than planned. And she said there's going to be a new system of fighting against the coronavirus, whereby hotspots, and there are about 70 of them in Germany, will be target of new rules. So people can't leave them beyond 15 kilometers in radius. You can leave your home, but you can't go 15 kilometers past that. Furthermore, schools will be kept closed until the end of January. The measures that were decided in mid-December will continue, so non-essential shops will be closed as well. She said it was a difficult but necessary debate that she had with the regional premiers, and that what she really wanted to do scientifically, as she is a scientist, is to be able to retrace the chain of transmission of infection, because there's so many cases now that they can no longer trace them with the German app, and she wants to be able to broaden the pool of people who can get vaccinated in the second quarter, because there's been a lot of criticism about the rollout of the vaccine here in Germany, which was the country that actually saw the first vaccine invented.
We're watching with a bit of a smile on this side of the Rhine when you talk about criticism of the vaccine rollout. We've had several thousand as of this Tuesday that have been vaccinated. You've had, what, 300,000?
Yeah, and I mean, the health minister is still under fire. I mean, these things are all relative. Germany, I think, did relatively well in the beginning of the coronavirus, and then the widespread impression is that people were a bit lackadaisical. The federal political structure of the country also meant it was difficult to apply rules in a uniform way, so there was a second wave, and that's where we're at. Expectations were high. Perhaps people, thought that the vaccine should come to them quicker. Because it was invented in Germany and built. The leading, as we heard in the report by Catherine Viet there, leading newspaper was criticizing the government's approach, and particularly the health minister, and saying it was wrong to join forces with the other European Union countries, and that perhaps there should have been a national purchasing strategy. And Merkel shot that down less than an hour ago, saying, no, we need to do this together as Europeans. It's not a go-it-alone kind of a situation. So what will happen politically, just the inside baseball here, Jens Spahn, the health minister, who's been getting a lot of airtime, going up in the opinion polls, people were talking about him as a possible future chancellor, now looks like he's going to be shunted aside in the vaccination efforts and replaced by a vaccination czar. Angela Merkel is taking control of things along with a number of other people to give the impression, at least, that more people will be vaccinated more quickly.
All right, so the COVID pandemic continuing to test political alliances and to test the nerves of ordinary citizens. In England, it's back to square one, so says the Daily Mail on its front cover. Reading the headlines this morning across the channel does make for, well, this feeling of a winter of discontent. The Eye, even more ominous with its front page, Lockdown 3, the worst sequel yet. More on that from our own Andrew Hillier.
A new year, but for many it's a case of déjà vu.
In England, we must therefore go into a national lockdown which is tough enough to contain this variant. That means the government is once again instructing you to stay at home.
The new measures mean that England is abandoning its regional tier system for now and entering its toughest lockdown since last March. People will only be allowed to leave their homes for food shopping, medical reasons or exercise. Schools and colleges will close to most pupils until at least the middle of February. This was a statement that Johnson didn't want to make, but with a new, more contagious strain of coronavirus ravaging parts of the UK and the NHS struggling to cope, he didn't have much of a choice. The UK has now recorded 50,000 new cases of coronavirus for 7 days in a row. But unlike last year, this time the country is already well into the biggest vaccine rollout in its history. The televised address came on the day regulators approved a second vaccine, this one by Oxford University and AstraZeneca, fueling hope that things could go back to normal by spring.
The weeks ahead will be the hardest yet, but I really do believe that we're entering the last phase of the struggle, because with every jab that goes into our arms, we are tilting the odds against COVID.
Johnson's announcement came just hours after Scottish leader Nicola Sturgeon imposed a similar lockdown north of the border. It follows similar measures already in place in Wales, where stay-at-home orders were issued before Christmas.
Alison Pollock, you heard in that report Boris Johnson promise it was the last phase of the struggle till the vaccines arrive. Your reaction?
Of foresight. But I think this second wave.
Alison, I'm going to interrupt you because we're having trouble with the connection there with Edinburgh. We're going to try to reconnect and get a better connection. Apologies for that. François Dabis, let me put it to you. First of all, for you personally, what's your frame of mind right now when you hear what's going on in Germany, when you hear what's going on in the UK, when you know what's going on here in France with some regions now under a tighter curfew? Do you see that light at the end of the tunnel? Are you optimistic or are you apprehensive?
Certainly apprehensive, as an epidemiologist, carefully scrutinizing the data on a daily basis. The control strategy in France has been, of course, evolving, like in other countries. And at the moment, we are trying to have a sort of a mid-term position with tighter, constraints in some regions and lesser constraints in other regions. And the expectation of the government at this stage is to avoid a big third wave of epidemic. But this has been very difficult for them to propose this and to have a real adoption of the population and the political leaders about that, because at the same time the vaccine criticism have emerged. And so for the government, it's difficult at the moment in France to tackle the two issues, how to do with the usual control measures, and at the same time to speed up the vaccine and the vaccine strategy. So that's the main difficulty.
And we can call up that map showing the parts of France that have that curfew that is now from 6 p.m. and no longer 8 p.m. And political leaders there upset, saying, why isn't it the whole of the country? Because, well, people travel.
You are right. This has been a concern, but clearly the epidemiologic situation in the country is very uneven, and therefore it made sense to do something harder in the region most hit. On the other hand, yes, you are right. People still travel and can travel easily in the country, but we have finished the holiday season, so some expectation is that there will be less travel between regions. And I'm not so sure, as you said, that some politicians criticize the fact that they were only they are pushing more constraints in some regions. In fact, the political leaders in these regions said the government could have even been stronger, proposing an entire lockdown for a week or two in their region, rather than a sort of a mid situation or average situation with a curfew from 6 p.m. to 6 a.m. So there are all sorts of opinions and views on that, and nobody has, of course, the right solution.
Alison Pollock, this must sound familiar to you, this argument over whether or not you put the whole of the country under a single lockdown, the same rules for everyone, or you do it by different regions. I know in England, it's been a big bone of contention.
Can you hear me?
Loud and clear.
Can you hear me? Okay, the problem is the government is heavily centralized. And so it really doesn't make sense, the lockdown for the whole of England and Scotland. The northwest and northeast of England do not have the same situation. And one of the big issues, of course, is the lack of beds and hospital capacity. So London and the southeast are very bad, where the beds are filling up and the ITU beds. But one of the big problems is the government never planned for this over the summer. And so we're stuck with the problem that the government over the last 20 years has closed beds. So it's very normal for us to see the hospitals full and the intensive care units overflowing. But what's added to the problem this winter is COVID. And the whole lockdown is being driven by lack of hospital capacity and beds, and also, of course, fear on the part of the politicians that, of course, they will be held accountable. But it doesn't make sense that all the schools have closed in every part of the UK. It doesn't make sense that all the primary schools have closed. But there are a lot of politics at play and a lot of forces which are pushing in the direction of total lockdown.
So you're suggesting that schools are not a vector of the transmission of the coronavirus?
Well, there's a lot of mythology about schools. And what we know is that children not only are least at risk, but they are less likely to be drivers of the infection. We know that. There's lots of good evidence around that. So at the very least, the government could have kept primary schools open. And I think there are really very big issues about the lack of preparedness to make sure the schools were ready and that the health service was ready for this second wave. And what's happening in London is having a ripple effect, because it's driving what happens in London drives the whole national lockdown, because we have a heavily centralized government and we don't have the regions and evolved administrations that you have, say, in Germany or even in France. And this is a major issue for us in the UK. We've lost our ability to manage things regionally, because over decades we've hollowed out the capacity of local government.
And when the Prime Minister says that that this is the last phase of the struggle, that the vaccines are coming, are you heartened by that?
Well, we're all very hopeful. But there are two issues. One is there is no doubt that immunity is being acquired in many parts of the country and by many bits of the population. And of course, one hopes that the vaccine will be effective. But these are new vaccines. We don't know about the duration of protection. And of course, the government has just recently changed the dosage and the administration. So it's trying to roll out the first dose to as many people as possible, but we don't know, and widen the distance between the second dose. That's highly controversial. But of course, everybody hopes that the combination of immunity that's happening as a result of the virus and the infection, combined with the vaccine, will actually help prevent a third wave, or with the third wave comes, it will be much smaller.
Tamara Giles-Vernick, you've just heard the rest of this panel now describing the bones of contention in France, in Britain, in Germany. Your thoughts on how the planet now comes together in this crucial period as they roll out those vaccines?
That's a really interesting and I think contentious question, actually. I think that there's a great need to. And even as Professor Dabis pointed out, that, people do move in France. People are moving even within countries. People are also, albeit maybe at a slower pace, moving around the world. So it's not just that the country next door to me, well, they've got problems and that's not my problem. Despite the enormous disparities in wealth and resources that we see across the planet and within countries, we are really all in this together. And there needs to be some concerted work together to ensure that everybody gets the vaccine.
Everybody gets the vaccine. I want to pick up on that point. We're going to have to take a very quick break. We'll be right back. Stay with us. You're watching the France 24 debate. Welcome back, or welcome if you're just joining us. It's the France 24 debate, and we're asking how humanity comes together during this dark period when it comes to returns to lockdown, not just in Europe, but around the globe in some instances. And as we wait for the rollout of vaccines, which, as Dr. Alison Pollock, who joins us from Edinburgh, said in part one of our discussion, are to some degree untested. She's professor of public health at Newcastle University. Welcome back as well to Dr. François Dabis, professor of epidemiology at the University of Bordeaux in the southwest of France. From Berlin, France 24 correspondent Nick Spicer, and Tamara Giles-Vernick, researcher on medical anthropology at the Pasteur Institute. Before I put a follow-up question to you, Tamara, Nick, can you just remind us, Nick Spicer, that rule they're putting in place about the 15-kilometer radius in Germany?
Sure. Well, wherever there is a hot spot, a high number of infections, people inside that hot spot will not be able to travel more than 15 kilometers. It's not yet clear whether regional authorities will be in charge of enforcing that rule or if it'll be done at a higher level. This is all part of Germany's struggle with the coronavirus, the federal nature of politics here. But certainly that is the intention, and that is the headline, 15-kilometer radius if you're living in a hotspot zone.
So, Tamara Giles-Vernick, the last time we had a major coronavirus outbreak of this kind, it was 2003, and it was in China mostly, and it was contained. This time, globalization has ratcheted up a notch. People travel all the time. Mm-hmm. Your reaction when you hear the kind of measure that's just been announced in Germany?
Well, I think when transmission is out of control, you need to do something, and governments need to do something. And so there's no question that additional measures need to be taken. Clearly, what happens in one country isn't necessarily appropriate to the next, but it does seem that there are certain kinds of measures that do appear to control transmission. And so, I think that it's necessary.
All right. There is, of course, this issue of, as we now wait for the vaccine, we're finding these new strains. The one in England is called the Kent strain, as in the county in the southeast. More contagious, not necessarily more virulent. We had a French rugby club, Bayonne, that was hit when Leicester came to visit recently for a European Cup match. 9 players and a staff member testing positive, forcing postponement of several matches. François Tabis, your thoughts on these new strains that are coming up, and whether or not we have an inkling or an idea as to whether or not the vaccines will work?
Yeah, first of all, you mentioned the fact that a big rugby team in Bayonne, which is nearby Bordeaux, was heavily contaminated, having played against a UK team. And which is interesting is that in these two countries, the rules to screen the players were not the same. And when you apply very different control measures, you may be unable to control transmission. Regarding the relationship between this new strain and the vaccine, we cannot say a lot today. There is a lot of testing ongoing, including by the company producing the vaccine, to absolutely confirm that the vaccine will work against this strain. There are early reports. In the early reports, they said that yes, but since then they have not confirmed that, and certainly the data are not publicly available at the moment. So I think we should be careful and monitor that on a daily basis, and hopefully have data on which we can make sort of a more informed either decisions or at least know what's happening.
Yeah, and even though it's summer in the southern hemisphere, Zimbabwe's had to reintroduce a curfew. So it's not just Europe. Ban on public gatherings, indefinitely suspending the opening of schools. In neighboring South Africa, the continent's hardest hit nation, authorities reimposing a curfew, banning liquor sales, and closing most beaches. South Africa, where scientists say it's too early to tell if vaccines will prove effective against their new strain of COVID.
I'm very worried about the new South African variant that we've seen, and that's why we've taken the very robust action to stop flights from South Africa. And my concern is that it seems to be even more easy to transmit than the new variant that we've seen here.
François Tabis, do you agree with Matt Hancock, the UK Health Secretary?
I think there is a real concern, and this is a serious concern. The data are not speaking extremely well at the moment, but every day new data is being accumulated, and the concern is real. The relationship again with the vaccine is very unclear. It may complicate a lot our vaccine and even our global control strategy, but at the moment we should keep the same measures and probably make them tighter whenever possible and whenever appropriate to the country or the local population.
So are politicians getting ahead of themselves when they're promising that there is light at the end of the tunnel?
We are going to have a difficult winter and spring, at least in the northern hemisphere, because obviously the vaccine campaigns are starting unevenly by country, but ultimately within a month or two, my expectation is that every country in Europe will have roughly the same coverage. Probably at this stage, the coverage will be insufficient to have a true impact on the epidemic. And so we are going to live for 3 to 6 months, during which we are going to make a lot of efforts to vaccinate people and not seeing this as a paying strategy. So it's going to be very frustrating and difficult. So the end of the tunnel may be in between July and September, not before.
Between July and September. Alison Pollock, your thoughts on whether, we may be living with COVID for a long while, and how do we adapt to it, and how do we adapt the strategy, the long-term strategy of how we deal with public health? All right, we seem to have lost the connection there. Again, with Edinburgh, apologies for that. I'll put that question to you then tomorrow, Giles Vernick. This is one coronavirus. Can we expect more? Is this going to become the new normal?
The first generation nor the last, I would say, to be dealing with epidemics and to be dealing with zoonotic spillovers. These are events that have been happening for a very long time. In
Explain to us what a zoonotic spillover is.
Sorry. A zoonotic spillover is a pathogen that originates in an animal and that spills over into human beings through a variety of ways, and that would be specific to that particular pathogen. Sometimes it can be a blood-borne disease. Sometimes it can be, through some kind of environmental contamination. But I think that I would want people to have a kind of, I don't know, historical amnesia. We have had, for instance, and have been living with the HIV pandemic for the last many decades. Certainly infectious in a way that may have moved more slowly than coronavirus, but human beings have been living with diseases for a very long time and have been living with epidemics and indeed pandemics for a long time. I think what makes this particular event unusual is the scale of connection, as you suggest. That it's not that globalization didn't start 10 years ago. Globalization started centuries ago, but there is a lot of movement. There's a lot of connections between people across the globe, which facilitates the transmission of something like this coronavirus. So, no, I don't think that this is the last time. But my hope is that governments across the planet and populations across the planet will be better prepared for it the next time.
François Dabis, working on HIV has been, if I may say, your lifelong endeavor since you've been working on it since the early 1980s. What lessons have you learned and can apply here?
Yes, it's clear that this is a different epidemic in terms of time scale, but there are lessons to be learned. One of the clear lessons that has been insufficiently applied during this particular pandemic over the past year is to work between the many disciplines together. So that's one thing that has been difficult, although we had a tremendous success with the vaccine in 1 year, whereas for HIV, we after 30 years, we do not have a vaccine. But working more between disciplines is essential, and disciplines of specialists working on animal health, working on environmental health, and working on human health. And this is clearly the future for exploring new epidemics in the future. And the second lesson that we have not well learned from the HIV pandemic over the past 12 months is to work closely with the civil society and involve more importantly, the civil society in decision-making process as well as in the scientific process as well. And so this is something for future epidemics that may be extremely important. Get the people involved, get the society involved.
Alison Pollock, you agree?
Yes, of course, it's important to have a proper democratic participation. The big lessons from the UK is that we've over-centralised our government and we don't have the levers in regions and locally to control epidemics. The second lesson is that we have hollowed out our public services. We failed to invest in schools and in health services.
So we have the irony that lack of capacity in health services is driving the lockdown and economic decisions here in the UK. The third lesson is that we've undermined and eroded democratic accountability. And fourthly, what the UK has done is it has privatized a lot of the epidemic response in a very bad way. So we've been very ineffective and inefficient, for example, with our contact tracing, with our testing, and with our healthcare. So there are many lessons, unfortunately, to learn from the UK about what not to do. I'm well aware that the same scenarios of the epidemic are playing out in different countries in different ways at different times. But many of the problems that we are now facing in the UK were avoidable and preventable if we had invested properly in public services and had strategic planning over the summer.
Nick Spicer, a lack of hospital beds is something that was talked about during the first pandemic here in France. I know where you are in Germany, and you said it at the outset of this show, that Germany was ahead of the curve compared to most of its neighbors during the first portion of this pandemic. Now, though, again, when we think about the lessons learned, again, in a globalized world, even Germany couldn't avoid this winter wave.
No, I think, there are reasons for that, and they have to do with the federal structure of German society. The constitution wasn't built to fight a pandemic. It was built to prevent another dictator from taking over. So pushing all the power down to the regions, no centralized decision-making, much to Angela Merkel's anguish. She gave her most passionate speech I've ever seen in 10 years working as a reporter here at the Bundestag, telling people this may be the last Christmas you spend with Grandma and Grandpa if you don't smarten up. So it was really not so much a matter of policy, I think, and politicians saying we must do this, we must do that. There was a lackadaisical attitude to a certain extent, because I think perhaps Germans recognized they were doing relatively well. And I'd just like to come back to what the other guests were saying about these things happening before and what kind of policy responses. I'm not prepared to talk about, or qualified, I should say, to talk about public health policy, but I think there is this virus, a philosophical virus of medical skepticism, which is spreading through the internet, through our cell phones, and I think that is something new. We've had pandemics before, the Black Death, the Spanish flu. It's different now when you have a big part of the population which is actively hostile to the idea of scientific discovery, facts, and news. And that is something that needs to be addressed by any policymaker. And it's something that I know you feel, Francois, and in our work, this whole fake news thing. And I think it's something that policymakers will have to address however medically they go forward.
Tamara Giles-Vernick, your job is to look at the long view on all of this. Is this something new, questioning science?
No, no, it isn't. Even if we talk about the Black Death during the medieval period, certainly there were rumors that circulated about who was getting sick, why they were getting sick, and who was to blame for it. That said, I would agree with the last speaker in the sense of scale. That scale is actually really important, and the rapidity with which certain kinds of stories circulate. I think the issue, though, is, I would say, as an anthropologist, is to try to understand why it is that people are saying what they're saying, and to try to dig into why that skepticism exists. Certainly, some of it can be related to educational systems, but one of the things that I've seen as both an anthropologist and historian is that people tend to draw on long-standing grievances. It's like throwing out a fishing net and, you sort of pull everything in to try to explain, why it is that, for instance, authorities are doing what they're doing. And they can draw on longstanding hostilities, grievances, other kinds of conflicts and tensions that exist within a society that are in fact exacerbated because of the presence of an epidemic.
So one final question on this. We spent most of 2020 asking about pangolins and whether the live animal market in Wuhan, China was the starting point of the epidemic. If you turned the clock back to exactly 1 year ago at this time, our attention was instead focused on those record wildfires in Australia. I ask you the question, Tamara, can we connect the dots between globalization, extreme weather caused by humanity's disruption of nature, and the current pandemic?
I think what I would go so far as to say, and I really don't want to go out on a limb here, actually. I think that we could certainly talk about the relationship between globalization and this spillover from an animal, probably a bat, into human beings. Whether we can link questions of climate change, and I'm not at all a climate skeptic, but how all of those phenomena are related, I think requires a better understanding. Not just a better understanding of what's going on a global level, but what's actually going on local levels that actually bring people into contact with an animal or that is either some kind of reservoir or some kind of amplifier of a spillover disease.
All right, we're going to leave it there. So much more to talk about, though. Tamara Giles-Vernick, I want to thank you so much for joining us from Paris. I want to thank François Dabis in Bordeaux, Alison Pollock in Edinburgh, and correspondent Nick Spicer in Berlin. Thank you for joining us here in the France 24 debate.